A 28-year-old woman returns for her routine check at 16 weeks. She has previously accepted prenatal screening, and in your office, the sequential form of screening is performed. When she is sent for her blood draw, she asks the phlebotomist why she is having a second prenatal screening test. The phlebotomist explains that this is how the test is done, and the patient asks, "What was the result of my first test?" The phlebotomist says they don't get a result from the first test until the second test is done. The patient accepts this. However, the phlebotomist asks you to explain to her how this works for the next time someone asks. As you are thinking about this, you review what your office tells patients about prenatal screening, which is contained in the following patient information video.
Hello, I'm Jerry Erickson from the Prenatal Screening Program at the Foundation for Blood Research. I'd like to spend the next few minutes telling you about prenatal screening tests. Prenatal screening is testing that is offered during your pregnancy to find out if you are at increased risk to have a baby with certain problems. Women whose risks are higher will have a screen-positive test result. Since these are screening tests, most women who have a screen-positive result will have a healthy baby. Prenatal screening tests can help find a number of conditions and problems in a pregnancy. Down syndrome is a condition that causes mental retardation, heart defects, and other problems. Also called trisomy 21, Down syndrome occurs more often in babies born to older women, but it can happen at any age. Many individuals with Down syndrome live into adulthood, but require support throughout their lives. 1 in 600 babies is born with Down syndrome. Trisomy 18 is a condition that usually includes mental retardation, heart defects, poor growth, and other problems. 1 in 6,000 babies is born with trisomy 18, and many do not survive to birth. Open fetal defects are openings in the baby's spine, head, or belly that shouldn't be there. Babies with open fetal defects have problems that range from mild to very severe. Prenatal screening for open fetal defects requires a blood test after 15 weeks of pregnancy. Babies with any of these conditions and their mothers may need extra medical care. If a woman knows that her baby will be born with one of these problems, she may choose to deliver her baby at a specialty hospital or make other pregnancy decisions. Prenatal screening can also help show if you may be having twins, how far along you are, or if you have a higher risk of premature delivery, a low birth weight baby, or problems with the placenta. A screen-positive result does not mean that the baby definitely has a problem, but suggests the baby has an increased chance for a problem. Most women with this result will have healthy babies. In most cases, you will be offered genetic counseling and an ultrasound examination to help you understand if there are problems with your baby. You may also be offered an amniocentesis. Your healthcare provider or a genetic counselor will explain the results and your testing options. In amniocentesis, a small sample of fluid that surrounds the developing baby is removed. This fluid can be used to find or rule out the conditions that your doctor has screened for. If amniocentesis reveals that your baby has one of these conditions, you will have a chance to talk with your healthcare provider or a genetic counselor about the test results and the decisions you may need to make. A screen-negative result means a baby is not at a high risk for having the conditions that this test screens for. A screen-negative result does not guarantee a healthy baby. If you are interested in prenatal screening, please talk with your doctor or nurse. I hope this information has been helpful to you in understanding prenatal screening. All of us at the Prenatal Screening Program at the FBR wish you a happy and healthy pregnancy and baby.
Check your understanding of these basic facts by responding to our questions, and then go on to Lesson 2 to learn more about prenatal screening tests and how they work.
After listening to each question, pause the video and select your answer. Then listen to see if you are correct. A screen-negative test result ensures that your patient will have a healthy baby. True or false? The correct answer is false. What are the 3 specific conditions screened for in prenatal screening tests? Down syndrome, trisomy 18, open fetal defects, trisomy 13, spina bifida, placenta previa, trisomies, nuchal translucency, anencephaly, placenta previa, chromosomal abnormalities, spina bifida. The correct answer is A. Most women who have a screen-positive test will have a healthy baby. True or false? The correct answer is true.